around 2003, 2004, the Mothers Union in this diocese of Miseno North gathered together and decided that they wanted to do outreach to AIDS orphans in their communities. Each woman recognized that there were many, many orphans in their parishes and in their areas. Children who have lost either one or both parents to HIV/AIDS, who live with guardians, extended family, volunteers, and sometimes in child-headed households where the oldest child is as young as 12. They decided to have Saturday programs for these children and invite them all to come to the parish, the main parish church, each Saturday. They provide a meal for them, generally rice and beans and some tea. They have them have extra classes for them, teach them, do extra tutoring as is grade appropriate for that child. And then they also have some time just to play and spend time together and kick a ball and do all the normal things that a child who's growing well should do. So when I first came to Miseno in 2007, I went and met with the Mothers Union at their weekly meeting and asked them what they felt the biggest health concerns were for these children. And they listed numerous concerns, but one among the largest was a concern about their nutrition and worm infections, intestinal helminth infections. So I gathered together a group that included a Peace Corps volunteer, several German medical students who were in the area at the time, and a couple other students from the United States who were here. And we went to 14 of the parishes and gathered data, including height and weight, arm circumference of the children, their ages, and then also got stool samples on these children in order to determine really how high the helminth infection rates were and which helminth species were most prevalent. And we found that there was an enormous amount of stunting. About half the children here are not as tall as they should be for their age. About a third of the children did not weigh enough for their height, so they were quite thin and underweight. And we found that about half of them, a number that was much higher than I expected, had some intestinal helminth infections. The most common was ascaris. Really about 95% of them had ascaris infections of those that were positive. And then a very few percentage, 1 to 5%, had trichoris or hookworm. Besides obvious abdominal discomfort that can come from helminth infections, there are numerous other problems that they can cause, the biggest being undernutrition. The worm is basically taking nutrition from the child, and so a lot of the stunting and chronic malnutrition problems stem from helminth infections. Another problem, however, is as a result of all of this, poor performance in school and resultant lower IQ. So treating children for worms as much as every 6 months for a community setting like this has been shown to improve not only nutrition status, but also improve school performance. There was such high prevalence of ascaris and such a high prevalence of worms. We were looking for a good deworming medication. It needed to be inexpensive and easily obtained here in Africa. And so we found mebendazole, which for a single dose for children, 500 milligrams, will deworm them, and you can give that every 6 months, which has been shown by the World Health Organization and other organizations to have good effect. This is a very inexpensive medication. It costs 20 cents for a single dose for one child. So I can deworm all approximately 7,000 children in the program for $350. Twice a year would be $700 a year. So it's quite a cost-effective intervention, and I was able to raise that money quite easily.